Have you ever looked in the toilet after urinating and noticed that your urine looked different than usual? Maybe it was much darker, unusually foamy, cloudy, reddish, or even had a strange color that caught your attention. Most people ignore these changes and assume they are harmless. But what if your urine is actually sending you a warning message? What if it is one of the earliest signs that your kidneys are struggling and need immediate attention? Your kidneys work around the clock, every minute of every day. They filter waste, remove excess fluids, balance important minerals, and help regulate blood pressure. The amazing thing is that kidney problems often develop quietly. Many people do not experience significant symptoms until the damage has already progressed. That is why paying attention to changes in your urine can be incredibly important. Today, I want to walk you through some of the warning signs that may appear in your urine and explain why they matter. Remember, a temporary change does not automatically mean something serious is happening. However, persistent changes should never be ignored. Let's start with one of the most common warning signs: dark-colored urine. If your urine looks dark yellow, amber, or even brownish, dehydration is often the first thing that comes to mind. And yes, not drinking enough water can certainly cause darker urine. But if you are staying hydrated and your urine remains unusually dark, it may indicate that your kidneys are not filtering waste products properly. When waste accumulates in the body, it can sometimes affect the appearance of urine. Many older adults accidentally become dehydrated because their sense of thirst decreases with age. They may not realize their body needs more fluids. A simple habit that can help is drinking water consistently throughout the day instead of waiting until you feel thirsty. Small amounts taken regularly are often easier to maintain than trying to drink large amounts all at once. Another urine change that deserves attention is excessive foam. Have you ever noticed thick, persistent foam that remains in the toilet long after urination? Occasional bubbles are normal. They can happen because of urine speed or toilet cleaning products. However, repeated foamy urine may indicate the presence of protein. Healthy kidneys act like highly sophisticated filters. They keep important substances such as protein inside the bloodstream while allowing waste products to leave the body. When these filters become damaged, protein can leak into the urine. This condition is often one of the earliest signs of kidney disease. Many people dismiss foamy urine because it does not cause pain. Unfortunately, kidney damage can continue silently while this symptom is present. That is why routine medical checkups become increasingly important as we get older, especially if we have conditions like high blood pressure or diabetes. Now let's talk about cloudy urine. Cloudy urine may look murky or less transparent than normal. Sometimes it can be caused by dehydration. In other cases, it may signal infection, inflammation, or problems involving the urinary system. While not every case of cloudy urine is linked directly to kidney disease, it should still be taken seriously if it persists. One challenge many people face is assuming that symptoms will simply disappear on their own. While that can happen occasionally, repeatedly ignoring warning signs may delay diagnosis and treatment. Early action often provides the best opportunity to protect kidney function. Another important warning sign is urine that appears reddish, pink, or contains traces of blood. This symptom often gets people's attention immediately, and for good reason. Blood in urine should never be ignored. There are various possible causes, ranging from infections and kidney stones to more serious kidney conditions. Sometimes the amount of blood is so small that it can only be detected through laboratory testing. Other times, the color change is clearly visible. The challenge is that many people feel fine otherwise. They have no pain, no fever, and no obvious illness. Because they feel normal, they delay seeking medical advice. Unfortunately, visible blood in urine is one symptom that deserves prompt evaluation. Let's also discuss unusually pale urine. Many people assume that very pale urine automatically means excellent health. While light-colored urine often reflects good hydration, urine that remains consistently colorless all the time could occasionally point to issues involving fluid balance or certain medical conditions. The key is noticing changes from your normal pattern rather than focusing on a single bathroom visit. Your kidneys depend heavily on healthy daily habits. One of the biggest challenges in modern life is the constant consumption of highly processed foods. Many packaged foods contain excessive sodium, and too much sodium can place additional strain on the kidneys over time. Learning to read nutrition labels and choosing fresh foods more often can make a meaningful difference. Another challenge is sitting for long periods throughout the day. Physical activity supports healthy circulation and overall kidney health. Even a simple daily walk can provide benefits. You do not need intense exercise. Consistency is often more important than intensity. The important thing to remember is that your urine can serve as a valuable window into what may be happening inside your body. Changes in color, clarity, and appearance may provide early clues that something requires attention. In the next part, we'll discuss additional warning signs, risk factors that quietly damage the kidneys, and practical lifestyle habits that can help protect kidney function as you age. As we continue, it is important to understand that kidney problems rarely appear overnight. In many cases, damage develops gradually over months or even years. The body is remarkably good at adapting, which means symptoms can remain hidden until kidney function has already declined significantly. This is why recognizing subtle warning signs and making healthy lifestyle choices can be so valuable. One urine change that many people overlook is a strong or unusual odor. Certain foods, medications, and vitamins can temporarily affect the smell of urine. However, if a strong odor continues for an extended period and is accompanied by other changes such as cloudiness or discomfort, it may indicate that something else is happening within the urinary system. Persistent changes should always be discussed with a healthcare professional. Another warning sign involves changes in urination frequency. Some people notice they are urinating far more often than usual, while others find they are producing much less urine despite drinking normal amounts of fluid. The kidneys play a central role in regulating fluid balance, so significant changes in urinary patterns can sometimes signal that these organs are under stress. Many people assume that kidney disease always causes pain. Surprisingly, this is often not true. In the early stages, kidney problems may cause no pain at all. Instead, the body may send more subtle signals. Fatigue is one example. When the kidneys are not filtering waste effectively, toxins can gradually build up in the bloodstream. This may leave a person feeling unusually tired, weak, or lacking energy throughout the day. Swelling is another symptom that deserves attention. Have you ever noticed your shoes feeling tighter than normal, or your socks leaving deeper marks around your ankles? Healthy kidneys help regulate fluid levels. When kidney function declines, excess fluid may begin accumulating in tissues, especially in the feet, ankles, legs, and sometimes the hands. While swelling can have several causes, persistent swelling should never be ignored. Let's talk about one of the biggest challenges facing kidney health today: high blood pressure. Many people think of high blood pressure primarily as a heart problem. In reality, it is also one of the leading causes of kidney damage. Over time, elevated pressure can injure the delicate blood vessels inside the kidneys. The unfortunate part is that high blood pressure often produces no obvious symptoms. Someone may feel completely fine, while damage slowly develops. This is why regular blood pressure monitoring is so important. A simple reading taken periodically can provide valuable information about your overall health. If you have been diagnosed with high blood pressure, following your treatment plan consistently can help protect your kidneys for years to come. Another major challenge is diabetes. Elevated blood sugar levels can gradually damage the tiny filtering units inside the kidneys. In fact, diabetes is one of the most common causes of chronic kidney disease worldwide. The encouraging news is that maintaining healthy blood sugar levels can significantly reduce the risk of complications. Now let's discuss practical lifestyle habits that support kidney health. First, make hydration a daily priority. Your kidneys need adequate fluids to help remove waste efficiently. The goal is not to force excessive amounts of water, but rather to stay consistently hydrated throughout the day. A good habit is keeping a water bottle nearby and taking regular sips rather than waiting until you become very thirsty. Second, pay attention to your diet. Fresh vegetables, fruits, whole grains, and balanced meals can support overall health. Reducing highly processed foods may help lower excess sodium intake, which can ease the workload placed on the kidneys. Third, remain physically active. Regular movement supports circulation, blood pressure management, and overall wellness. Even moderate activities, such as walking, gardening, or light stretching, can contribute to long-term health benefits. Fourth, prioritize routine medical checkups. Many kidney-related issues can be detected through simple urine and blood tests before symptoms become severe. Early detection often allows for more effective management and better outcomes. Another important tip involves medications. Some people frequently use over-the-counter pain relievers without realizing that excessive or prolonged use may place strain on the kidneys. Always follow label instructions and consult a healthcare professional if you regularly rely on these medications. Finally, never ignore persistent changes in your urine. Dark urine, foamy urine, cloudy urine, blood in the urine, unusual odor, or significant changes in frequency may all be important clues. While these symptoms do not automatically mean serious kidney disease, they are signals that deserve attention. Your kidneys perform hundreds of essential tasks every single day without asking for much in return. The choices you make today, staying hydrated, eating well, staying active, managing blood pressure and blood sugar, and paying attention to warning signs, can help support these vital organs for years to come. The next time you notice a change in your urine, do not simply dismiss it. Take a moment to pay attention. Sometimes your body speaks quietly before a problem becomes serious. Listening to those early warnings may make all the difference in protecting your health and preserving your kidney function for the future. Remember, awareness is not about fear. It is about giving yourself the opportunity to act early, make informed decisions, and take better care of one of the hardest working systems in your body. Your kidneys work for you every day. Taking care of them is one of the smartest investments you can make in your long-term health.